name is Chylsi Summers. I'm with VTHT 2223, Clinical Pathology I. Today I'm going to demonstrate how to draw blood on a dog. So what you'll need is a 3cc syringe with a 22 gauge needle, a purple top tube that has the vacuum, and some alcohol. So we'll draw it from her leg. Have someone hold off for you, and then you'll feel for the vein. And put some alcohol on it to make it help it stand up and sterilize it. You always want to make sure that the bevel is up. And you'll go in slightly and draw back on your syringe. And then once you've got enough of your sample, you'll hold off with slight pressure. Then you can put the needle carefully into the purple top and it will vacuum in the blood for you. And then you want to slightly just rotate it back and forth so that all of the coagulant will get into the blood so it doesn't clot. And that is how you draw blood. So now I'm going to demonstrate how to do a blood smear. You will need some blood, 2 wooden stick applicators, and some slides. So you'll take your blood, you'll put the 2 stick applicators in it, kind of move it around to where you get some blood on the sticks. You'll place 1 drop towards the top of the slide, like that. With the second slide, you're going to take it and keep this slide flat. You're going to take the second slide at a 30-degree angle, scoot it back into the blood, wait till it's completely across the bottom of the slide, and then slide forward with an even motion. And you should get a blood smear that's thick at the top part, and then it goes into a feathered edge at the end. And that's how you make a blood smear. Now I'm going to show you how we stain a blood smear slide. So you want to make sure that it's dry. If it's not, you can just wave it in the air for a little bit until it is, but this one's pretty dry, so we're just going to go ahead and stain it. So here we have our stains. We use the Death Quick 3-step stain. So the light blue is the fixative, that's 95% methanol. The red stain is the eosin component that buffers at an acidic pH. This stains like basic components. And you have the dark blue stain, which is the methylene blue component that buffers at an alkaline pH that stains acidic components of the cell, like the leukocyte nuclei. And so now I'm going to show you how to stain this blood smear. So we use little clips, that way we don't get the stain on our fingers. You want to dip it in for at least 30 seconds, and then you can switch to the next stain. And then we'll go to the red stain. And I just kind of dab it off to make sure we're not mixing them. You'll dip that for 30 seconds. You also can rinse in between the stains with distilled water, but you want to make sure not to get the distilled water into the other stains. So I just like to dip it off onto the paper towel because it can mess up the staining process. And then just kind of dab off the excess and then into the dark blue. Alright, and once your slide is stained, you're gonna just dab it off. You come to the sink and you're gonna use distilled water to rinse it all off. You don't want to just drench it, so you want to go kind of slow. You want to rinse off all sides. And that is how you stain a slide. You'll let it dry. You want to make sure that the feather end is pointed up so that it dries evenly. slide is dry, we're going to go ahead and look at it under the microscope. So, stick it on the microscope. You're going to start at the thick layer. And this is where you can check for any clumps of platelets or any abnormal cells, so microfilaria if they have any. And you'll just slowly make your way through. You'll start off at a low magnification, and we'll go to the 100 magnification to get a better look. And focus it. And we'll just keep going through until you get closer to the feathered edge. Keep going and keep looking for any abnormal cells. Okay, so now the cells are starting to break up a little bit and spread out. So we're getting closer to the monolayer and the feathered edge. So once you hit the feathered edge, it's going to be all the cells are going to be very spaced out. So you'll go back a little bit to hit the monolayer, and that is where you can do your count of all the differential cells. And once you're there, you're going to want to go up. This is the 400 magnification. You can just focus it a little bit. And then before you go to the 1000 magnification, you're going to use some of the oil. And this just helps you see. It'll be magnified a little better. And you just need a tiny bit. And then you can go into the 1000 magnification. And then you can look through and see if there's any neutrophils, which there are quite a bit on this one. Okay, so we're still looking at the monolayer to look for any abnormal cells. At the monolayer is where you can do the differential cell count, and there's multiple ways you can do it. Some people have like a counter where you just, when you see like neutrophil or lymphocyte or anything like that, you just click it, or other times you can just log it down as you see them. So there's quite a bit of neutrophils in here. Eosinophil. There's another neutrophil. So you want to count at least up to 100 white blood cells, and then you get your percentage of everything. So that's how you read a blood smear. Now I'm going to show you how to do a packed cell volume and a total solids test. You're going to need the hematocrit tubes. We have the tiny ones, but they also make larger ones. You're going to need the clay and this little stat spin to put into the spinner. So we have our blood here. I'm going to open that up. And you're just going to want to fill the blood up. And it's just up until it's past that red line, and then you'll dip into the clay to make sure that it stays clogged. And we'll do another one. Okay, so 2 should do it. We'll put it in the stat spinner. You want to make sure you put the clay towards the outside so when it's spinning it doesn't fly everywhere. And then you want to put them exactly across from each other. Make sure that they're in there. And put the lid on. Then you'll put it into the centrifuge. Which you have to take these out to put this in. And close. You want to make sure you put it on the hematocrit. And then push start. And then that takes a little while to spin. Okay, so now that it's done spinning, you'll open the centrifuge up and you will twist this to pull these out. And here we have our hematocrit reader. We'll close that. So you want to make sure that the clay is at the very bottom of the red, at the 0 mark. So, and then you'll read it to where the buffer and the red blood meets. So,
she's coming tomorrow. We'll need to load her up.
Looks like it's about probably 56. And then that's it for the PCB. Now we're gonna look at the total solids. So you have the refractometer, and we're gonna use our hematocrits that we had from before. You're gonna carefully break it, and you're going to try not to scratch it, but try to get some of that fluid on there. Okay. I'll go ahead and do the other one just so we can make sure we have enough. Try to get in about the same spot. Okay. And then you'll close the lid. Alright, so you point it up to towards the light source, and it looks like it's at the 6 for the total solids. And that's how you read the refractometer for your total solids.